best way is to have a mood stabilizer on board. And if the mood stabilizer doesn't take care of both the highs and the lows, if there are depressions, then working with treatments that will finally stabilize it over time, which is the reasonable expectation in every individual who suffers from bipolar disorder. I will also say that bipolar disorder is one of the most misunderstood illnesses out there. When someone is adequately treated, you would never know that they had this illness. And once it is treated and someone stays on their treatment modalities, they don't look any different. They are no different than anyone who doesn't suffer from bipolar disorder. And so I think it's important to recognize that and try to remove the stigma, just basically, again, for the individuals who suffer from it, and once their moods are stable, is to watch like that mole on the back, to just make sure sleep is good, minimize the things that they know or patterns that they know may provoke a depression or a high, and do everything they can to try to keep that mood stable. For individuals who suffer from bipolar disorder, I think they have to be realistic of the expectations. First of all, for many of these people, they may not have received the correct diagnosis for years after they may have had their first depressive episode, so they may already be frustrated. When they eventually find a combination of treatments or a treatment that works, they still have to monitor for potential any roughening of their illness. I'll call it roughening, whether it's a high or a low. They need to still monitor sleep hygiene, which is critical for someone who is bipolar, to try to keep good sleep hygiene. It's also very important that there are other players, whether it's the clinician who's treating them, whether it's a family member, because very often someone who suffers from bipolar disorder may not see those early signs of when they may start to cycle up. They may find they're getting a little more creative, they're talking a lot more on the phone in the middle of the night, maybe staying on the computer late. And so I think it's important to find a partnership and have someone else who will be there and follow that individual, because there may have to be minor changes along the course of this illness to make sure that it does remain stable, which should be itself a reasonable expectation.